Alex Howard, and welcome to this short video. And in this video, I just wanted to answer a question that we sometimes get asked, which is, if OHC is a charity, why do I have to pay for treatment? So the first thing that I should say is that we find it incredibly frustrating here at the Optimum Health Clinic that we live in a country where we have this amazing thing, certainly here in the UK, called the National Health Service, where if you get sick with the vast majority of conditions, you can be offered effective forms of treatment. And it's very frustrating that with effective interventions for ME chronic fatigue, many of those are not currently funded by the NHS, or what we would perceive, let's say, to be effective treatments. And the main reason why that's the case is that for anything to be funded by the NHS, it has to be in the NICE guidelines, which is the National Institute of Clinical Excellence. For something to be in the NICE guidelines, it has to be considered to have a substantial evidence base behind it. And what drives the evidence base, you can probably guess, is how much research money there is, and of course something being effective. Now, we would argue that many of the things that we offer at the Optimum Health Clinic, we find clinically, we observe them to be effective with a number of patients. But we need to build the evidence base behind those treatments for them then to be accepted by the NICE guidelines to then be able to get NHS funding. And as a charity, currently all of the money that we fundraise, we use to drive research, to fund our research program. And all of the profits that we generate through the Optimum Health Clinic, and I should say we don't run the Optimum Health Clinic with profit as the primary motive, but we do make a little bit of profit, all of that also goes directly into research. Now, something that we've thought about for a great length, a number of times over the years, is should we use the money that we generate through fundraising through the clinic to fund people to have free treatment? The problem with doing that is we would only ever be able to help a relatively small amount of people, and we wouldn't move forward to the ultimate situation. If we're funding research, the vision is that in the medium to long term, everyone potentially can have access to the kind of treatments that we offer here at the Optimum Health Clinic. And therefore, that's why we focus our resources towards doing research, towards making that possible. Now, it is very sad for us that many of the people that contact us are not able to afford the full amount of support that they would like, or sometimes even any support. And we do the best we can through video blogs like this, for example, and through our website and through YouTube, and also through things like Secrets to Recovery, to provide as much access as we can to our resources, as freely as we can. But if you want to help us, ultimately to make the situation different, the best way to do that is to help us with our fundraising campaigns. The more money we fundraise, ultimately the more research we can do, we can hopefully start to change the NICE guidelines, and then everyone in time, hopefully, can get access to the kind of treatments that we offer.